Well, welcome everybody. Really happy to be here to talk to you about, the focus is going to be on Qigong Massage, which is a wonderful modality for treating autism. But before I start, who here has an autistic child or grandchild? Oh, wow. All of you. Okay, wow. All right, how many of the children are 6 or under? Okay, all right, and how many are, say, 6 to 15? Okay, all right, so you've got fairly young kids. All right, so has anybody had any familiarity with Qigong Massage so far? Has anybody heard of it? Oh, wonderful. I love it. Well, that's a really good start. So how did you find out about Qigong Massage?
I don't remember, honestly. I think part of what kept me from the reason I have the book and haven't done more with it is because it isn't real encouraging about using it with older children in the book. And so I sort of read the book and then said, well, we're doing other things, so.
Right. And how old is your child?
13.
Okay. Well, actually, they have done some research. I was going to get into this a little bit later, but they have, subsequent to the publishing of that book, they've done a research study on 6 to 12, and they found similar results. They found that it's a little slower, but they still get good results with 6 to 12. And I personally think it's good for everybody, you know, whether you're autistic or adult or child or whatever. Just like massage is good for everybody. As part of my training, I practiced with my mother, who's 79, you know, and so we would do exchanges. She would practice on me, I'd practice on her. She has a recent diagnosis of Alzheimer's, so I feel like it was probably helping her with her cognition and that sort of thing. So it's not ruled out for kids that are older. It's just that most of the studies have been done on younger children. But I've been an OT for 31 years, and it's been a chronic frustration for me that the traditional tools of occupational therapy are not as effective as I would like them to be. Has anybody had that experience with OT? Yeah, okay. Yeah, I mean, it's my profession, but, you know, I just get discouraged when things don't work as well as I want them to. So I'm always exploring different modalities to try to expand my toolbox to try to find the most effective modalities I can find. And actually have prayed about that, you know, show me what's most effective so that I can practice that. And I think Qigong Massage is one of those. I've been a massage therapist for, I guess, about 16 years, 15, 16 years. So that was kind of one of my first explorations into other things that might help. Right before I was a massage therapist, I was trained in a type of touch therapy called Reiki, and then I've been trained in several different kinds of touch therapy since then. And I found they're all effective, and they all kind of overlap. They work. A lot of the underlying principles are the same. So. Anyway, I'm really excited about Qigong Massage because there is very good research behind it, and it's one of the most effective modalities I've ever come across, and possibly the most effective modality for autism. Oh, I'm sorry, thank you. Okay, I'll try to talk louder. So what is Qigong Massage? It's a touch-based massage, but it's not done in the same way as like Swedish massage, where it's more of a kneading of the tissue, and the client typically, you know, gets undressed and they're draped with a sheet. And I do perform that type of massage as well. But one of the things I like about Qigong Massage is it's done through the clothes. So it's a lot easier working with autistic children if you don't have to worry about disrobing them and keeping them draped and all that. So they just keep their clothes on, they take their shoes off. And it's a series of 12 patting and tapping motions. So you start out at the top of the head and you pat all the way down the spine and then down the legs and to the heels. And then there's another motion where you go along the sides of the spine, and then the child turns over, and then there's more movements, always working from the head down. So, and that's one of the main principles of Qigong Massage, is that you want to bring the energy down. It's a 15-minute massage, and what I am certified in is parent training. So I can teach parents or grandparents or whoever wants to learn, I can teach you how to do this with your child. And that's one of the things I love about it, is it's so empowering for parents and family members. It gives you something very effective that you can do for your child. But what the research has shown is that the results, it's much more effective if it's consistent. 7 days a week is what is suggested. If it's not performed as consistently, the parents don't get the same kind of results. So it really needs to be every day, 15 minutes. The studies they first did were on a 5-month treatment, and they found that if parents continued it for a year, they had even better results. And if they continued it for 2 years, they had even better results than for a year. So it was developed by Dr. Luisa Silva, who's a medical doctor and also an acupuncturist. And she developed it in conjunction with Anita Signoloni, who was her mentor, also a physician and a doctor of Chinese medicine. And it's based on practices that have been used in the East for literally thousands of years. And it's kind of astounding to me as a healthcare professional that all these principles of Chinese medicine are just now starting to be recognized in Western medicine. And it's surprising to me because they're so powerful and so can be so potentially life-changing, and we're just now getting around to starting to study them. Since 2003, Qigong Massage has successfully treated more than 1,000 children in the United States. So what makes it unique? It's been shown to improve behavioral, language, and sensory aspects of autism. It substantially reduces parental stress, and they know that this from documentation. You do a before and after parent stress evaluation at the beginning of the treatment and then at 5 months. It's consistently effective for all levels of autism, so those that are more mildly impaired all the way to the more severely impaired children. It grants children access to more normal development. It helps children feel more comfortable and connected to others. It contributes to improving lifetime outcomes, and the results can be apparent in as few as 30 days. And I will say, typically when you first start this with an autistic child, the child resists, because as all of you know, autistic children tend to resist touch and tend to be resistive to it. And part of that is because they have energy blockages in the channels that flow through the body, the acupuncture channels. And so when they're blocked and then you tap on them, it feels uncomfortable, and so they resist and they want to push you away. But if you can persist with it, gently, then eventually those channels clear, and then the child receives the touch much better. And because the channels clear, then the underlying structures, for example, here the ears, improve because the flow of life force energy, or qi, is increased. So it can be very effective, but I will say initially, usually they resist, and then after a period of time, usually they relax into it and really enjoy the massage. And I have the children I've worked with so far, they did resist at first, but they got to the point where they requested the massage. They would ask for the mom to do it. So they've done a lot of research on it, and it's all on the website. The website is qsti.org, and it has a tab for research. It has now 21 research studies on it. But in 15 of the published studies, some of them had to do with validating the tools that they used. But the other studies that had to do with the actual treatment that were conducted in preschool children ages, since 2005 with 5 months of treatment. They found that behavior improves 32%, touch improves by 49%, sensory problems improve by 38%, children are more affectionate, engaged, and receptive in the classroom. And receptive language improves significantly. Parenting stress is reduced by 44%. So those are, those, for any of you probably all of you have kind of looked into different modalities that are most effective. And I think those figures are astounding. I mean, I haven't found any other modality that matches that, with the possible exception of diet. Diet is extremely important too. But that's just with 5 months of treatment, those astounding figures. And to give you a quick case study, the first child I worked with was a little 4-year-old, and severely impaired, had a few words, but not many. Was able to functionally, say juice, for example, water. I think he said water, but his language was very, very limited. He flapped his arms. He walked on his toes. He had tantrums. He didn't engage with his younger brother, who was almost 2. He didn't engage with his family members. He basically played with his iPad. And he would engage a little bit with his mother. He would allow his mother to hold him and that sort of thing. But as far as extended family, he didn't play with them. He didn't pay attention to them. He didn't interact with them. His eye contact was really limited. So with 5 months of treatment, what I found is that his arm flapping went away, his toe walking went away, his language improved. In fact, when my last treatment session with him, he actually told me goodbye for the first time. And he started interacting with family members. He started interacting with his younger brother. He started interacting with his I can't remember if it was cousin or his uncle who was kicking a ball with him. His first time he had done that. Started to show an interest in learning how to ride a tricycle. So really, really practical improvements. And that was just with 5 months of treatment. So when they did a 2-year follow-up study, they found that all children improved with continued treatment. The autism severity decreased on average by 44%. 1 in 4 children moved off of the spectrum, and over 50% of high-functioning children moved into the non-autistic range. And that's the first modality I've heard of where they actually move off the spectrum. So 50% of the high-functioning children with 2 years of treatment. The sense of touch recovered fully, and research shows that similar results were possible in older children ages 6 to 11. But I would certainly try it with a child at any age. So why does it work? The problems with touch delay normal development. And when you think about it, when a child, you know, when even with a newborn, I mean, the primary way that the mother interacts with a child is through touch, you know, through breastfeeding and through rocking and through cradling. So touch is really, really important for normal childhood development. And with autistic children, as you know, a lot of times they don't receive touch well, and so they're fighting you, or they don't want to cuddle, or they don't want to give you a hug, and they're pushing you away. And so they don't get all that normal sensory input that a little baby would, or an older child too, because they're resisting it. So if you can normalize a sense of touch where a child receives it more easily, then they can be nurtured that way, and that can assist in their development. Also, they found that there are tiny sensory nerves called C-tactile fibers that are important for bonding and for sensing the pleasurable aspects of touch. And they recently did a study where they took biopsies in 4 autistic children, little skin biopsies, and they found that they had much fewer C-tactile fibers. So they had a 50% loss in these fibers. So what Qigong Massage can do is actually normalize that sense of touch. It also increases the flow of Qi, and that's why it's called Qigong Massage. So who here has heard of the term Qi before? Oh, good, excellent. All right, speaking to a good crowd. So you probably know that Qi is also known by different terms in different languages. It's known as Ki in Japan, it's known as Qi in China, it's known as Ti or Mana in Hawaiian, it's known as Oigong or bioplasma in the West, and also life force energy. But it is a very real thing, and it was pointed out to me by my daughter when she was about 6 years old. I had been praying for the gift of healing, and a few months later she asked me to go lie out in the hammock with her. So I was lying in the hammock with her, and she was pointing out little bubbles of light that she could see, and I didn't know what she was talking about. And so I started telling her about fireflies, though I didn't see any fireflies. And she said, you know, then that's not it, you know. And then it was weird. All of a sudden, I could see all these little bitty bubbles of light floating around in the sky, like half the size of a rice grain, little bitty. And so I described them to her, and she said, "Yeah, that's it. What is that?" And I told her I didn't know, but I would pray about it. So a couple of months later, I was in a Bible study class, and a 4-year Bible study class, and one of the other participants in the Bible study class gave me a book called Hands of Light by Barbara Brennan. And the first page of the first chapter talks about these little bubbles of light, and that's the Qi. So some people can see it. I can see it sometimes, and most of the time I don't see it, but if I've been fasting or meditating, I'm more likely to see it because it opens up areas of your brain that they're able to perceive it. It's a higher frequency of vibration than the human eye normally sees. So has anybody here seen those little bitty bubbles of light? Okay. All right. Well, I like it when at least one person has. But anyway, I did a lecture one time to a group of chaplains and was telling them about this, a group of chaplains at Baylor, and actually a high percentage of the chaplains could actually see this life force energy. So I thought that was pretty cool. But if you go out and look at the blue sky, it's most prevalent in the springtime or in really natural areas like the beach or out in the forest. You know, you can see a patch of clear blue sky, and just kind of focus on that, but not intently. Just kind of let your eyes be sort of daydreamy and unfocused. And with time, you'll probably see these little bitty bubbles of light floating around. So that's the life force energy, or the Qi. And we have an energy system that draws in this Qi, and then it's circulated through the body through these channels known as meridians, which are the acupuncture channels. So what Qigong massage is tapping or patting along those channels to unblock them so that the Qi can flow through better. And since the Qi is a very healing energy, then the more Qi you have flowing through your body, the more vitality you feel, and the healthier you can be on mind, body, and spirit levels. So that's basically the principles behind acupuncture as well. They just use little bitty needles inserted along the meridian lines to unblock the meridians. Also, there are other types of massage that use these principles. Shiatsu massage, for example, is thumb pressure or palm pressure along the meridian lines to unblock the meridians. So that's basically how Qigong massage works, is it unblocks the meridians so that the life force energy can flow through better so that we can be healthier. Let's see, I covered all that. So this just shows you some pictures of the anatomy. The slide with the black background, the side view, shows that there are energy centers in the body. That's also illustrated on the one to the far left-hand side, my left. Those energy centers are the circles, and those are also called chakras, and they pull in this life force energy. So the sideways view shows what the chakras look like from the side, and they spin in a clockwise direction typically. And as they spin, they pull in the life force energy, and then it's circulated through the meridian lines, which are illustrated with the gold figure. So different points in the energy, the meridian lines will affect different organs in the body and different aptitudes. For example, like I said, the tapping along the ears here helps open up the language, and also the fingers help open up the language. So that's basically Qigong massage in a nutshell. It was advised to me in my training that when I teach parents, I have them do 12 sessions to learn how to do this. I don't think that that's going to be necessary all the time, especially if you have the book and you read the book. The book comes with a DVD, and that's at the end of the slideshow, the reference to the book. But it's Qigong Massage, Treating Your Child with Autism, I think is what it's called.
Helping your child with autism.
Yes, okay, very good. Helping Your Child with Autism, and it comes with a DVD, and Dr. Silva is on the DVD illustrating how to do the massage. So a parent I'm working with now also had the book before she contacted me, and she's been practicing with the book and the DVD set. She's come in for one session so far. And so what I was able to do is, say, yeah, that's right. With this one you want to make sure you end at the heels, and with this one you want to make sure you do it this way. So I'm able to give a little added coaching after she's already had the basics. If you don't want to do that, you can come in and I can teach you from scratch, but it would take more sessions to do that. But the way I got into Qigong massage in the first place is that I had studied craniosacral therapy for pediatrics, and who here has experienced? Okay, well, very good, very good. So it's a very, very subtle type of modality, and I had practiced it some with adults, but as you know, practicing with adults is not the same thing as practicing with children, much less autistic children. And I know there are some therapists that practice following the child around the room and trying to do these gentle manipulations. And honestly, I didn't feel like I was good enough at it to be able to do that. I do much better if I can have the child still, or when I work with adults, it's much easier. They just kind of relax into it, and I don't have a problem with it. So I was looking for a modality to help them relax enough that I could then do the more subtle work of craniosacral. So I was looking for a massage program for kids and stumbled upon Qigong massage that way. But what I have found, when I started looking at the research, and I was so impressed with the research, I thought, well, really this stands on its own. But I think it's even better when you can combine the two. So, maybe starting out with a Qigong massage, and what I would do is have the parent demonstrate it and then coach them through it. And then I would finish, if the child's relaxed enough, with craniosacral therapy and just do a few minutes of that. with a child I'm working with currently. First session, he was a little freaked out, didn't quite know what to expect. And here we are in a doctor's office, and they associate doctor's offices with sometimes pain and prodding and that sort of thing. So he, at first session, it's like, well, what are we doing? And I'm not familiar with this. And, it was helpful that his mother had already been doing the massage some. So that was helpful. He knew kind of what the massage was. He just wasn't used to doing it here with me around. So he didn't relax enough for me to do the craniosacral afterwards. But I think with future sessions, I think he will relax enough that I can do that. So we just sort of play it by ear, as well as the time. Generally it's about a half an hour to 45 minutes a session. It can go longer than that if the child can be relaxed enough and I can add more craniosacral. It can be shorter than that if the child just totally tells me they're done, So that is flexible too. But I just want to go over some other types of touch therapy that I like to practice in conjunction with Qigong Massage. They did a massive literature review, a systematic review called a Cochrane review. Has anybody heard of Cochrane review? It's like the gold standard for systematic reviews of the medical literature. So they pick a topic and then they look at all the quality research that's been done on it, and then they distill the main points from the research. So what they found with touch therapy is that it decreases pain, produces a relaxation response, accelerates healing, facilitates the expression of stored emotions, facilitates a shift from negative to positive emotions, induces a sense of peace and well-being. They found that there were better results with more experienced practitioners, and that some forms of touch therapy are more effective than others. And I found the same thing. They found, for example, that Reiki was more effective than healing touch. And I'm trained in both, and I think they're both wonderful and both very effective, but I tend to use Reiki more than I use healing touch. So craniosacral therapy is a gentle, hands-on approach pioneered by osteopathic physician John Upledger that releases tensions deep within the body to relieve pain and dysfunction and improve whole body health. And part of that is because there is a craniosacral rhythm of expansion and contraction. It's very, very subtle, but we're all doing that all the time. Our cranium is expanding and contracting and expanding and contracting. And you can tune into this a little bit if you just kind of feel, maybe not now, but just feel your head, and you can start to feel this very, very gentle expansion and contraction. And the limbs go into external rotation and internal rotation. So there's just this natural, subtle rhythm that's going on all the time. And where there's a trauma, for example, then there's a kind of a tightening, and the rhythm doesn't happen in its full excursion the way it's supposed to. For example, if the head is supposed to do this, it kind of goes like this, And so then, since it's not doing its full excursion, it's not doing the full pumping of the cerebrospinal fluid through the body. And also the pumping of the chi, or the life force energy, through the body is restricted. So if you can ease those restrictions through this very, very gentle therapy, then you can improve that excursion and improve the flow of cerebrospinal fluid and also life force energy. So craniosacral therapy can be used with autism, with developmental disorders, learning disabilities, ADD, ADHD, PTSD, migraines and headaches, chronic neck and back pain, stress and tension, motor coordination problems, brain and spinal cord injuries, chronic fatigue, fibromyalgia, TMJ, scoliosis, central nervous system disorders, orthopedic problems, and many other conditions. So it can be used for essentially everything, because all of us have traumas that we've stored, unless we're just really, really lucky. We've had emotional traumas or physical traumas, maybe a car accident, maybe a birth trauma, maybe, an abusive parent. And so we hold these traumas in our bodies, and these type of modalities, whether it's craniosacral therapy or touch therapy or Qigong massage, can help release those traumas. And when you release those traumas, then the life force energy can flow through better into those areas. And it's something the body does very, very actively. For example, I was a premature baby, and when people would work on me doing Reiki, my head would go side to side, and I never knew why. And finally, one of the practitioners who was working on me asked me, she said, "Well, you were a preemie, right?" Which I had told her, and I said, "Yeah." And she said, "Well, I wonder if you had an NG tube." And I told her I didn't know, but I would ask my mother. And for those of you who don't know, nasogastric tube goes up the nose and around the bend, around the back of the nose, and then down into the stomach. and they use it for feeding. And so I asked my mother, I said, did I have an NG tube when I was a newborn? And she said, well, I don't know, that was back in '62, and they didn't let parents into the newborn nursery then, and you were there for 3.5 weeks, and I don't know. So I'm like, okay, abandonment on top of, the NG tube trauma. But, I don't have any conscious memory of that, but my body remembers. And so one of the things that happens is the body tries to go into the position it was in when the trauma occurred. And it just so happened, one of my healing touch classes that I went to, there was a woman from my church that is a neonatal ICU nurse at Harris. She was in the class and she was observing me as my partner was working on me, and she was watching my head go side to side. And we did share our experiences afterwards. The teacher asked for experiences, and I mentioned that I was a preemie and that someone had speculated that I had an NG tube. And so this woman who was a nurse stopped me in the bathroom later, and she said, I just wanted to let you know that the posturing you were doing when that other person was working with you is the same as the posturing the babies do when they're trying to keep us from sticking the NG tube up their nose. And she said, and all of the preemies get an NG tube, and we replace them every 3 days, and we don't use any anesthesia. So that explains, why, I'm like, don't do it, don't stick it up my nose, So my body very actively tries to release that. When I meditate, for example, or when I get a massage, or when someone does energy work, and my body's always trying to release that. And I think it's been successful. It's still there a little bit, but it's much better than it used to be. So that's just an example, and all of us, I think, every single one of us has some sort of trauma that we've held. So when the body's releasing these traumas, it's called somato-emotional release. Somato meaning body, and emotions. So it's a therapeutic process that uses and expands on the principles of craniosacral therapy to help rid the mind and body of the residual effects of trauma. So it locates and releases what they call energy cysts, or concentrated areas of where we've held the trauma. They're kind of in concentrated little areas sometimes, and they're called energy cysts. Has anybody had the experience of having a massage and just suddenly bursting into tears? Okay, all right, so a few of you had, yeah. And a lot of times you don't know where it came from or why you're crying. The massage feels good. But what has happened is the therapist has tapped into an area where you've held trauma, and your body's actively releasing it. That's one of the ways the body releases trauma, is through crying. Also with somato-emotional release, you can incorporate therapeutic dialogue, where you can you have the client identify areas of tension or areas of pain or areas of concern, and then you can actually talk them through talking to that area, which helps them tap into the genesis of it, and the root cause, and help them release what they need to release. And I'll give you a quick example of that. When I was taking my last craniosacral class, the somato-emotional release class, there was a PT in the class, and we all introduced ourselves. It was a 4-day class, but we all introduced ourselves the first night. And she said, I like to be pretty guarded. I don't like for my emotions to show. Because he asked us what we were concerned about with the class. And she said, I'm concerned because this class is all about releasing stuff, and I don't want to release stuff, and I don't want to keep it, closed in. So it happened that she was my partner on Saturday before the last day on Sunday, and we were practicing these methods. And so I was trying to do the dialogue with her, and she was being very evasive. And I said, we'll give it a name, which is one of the techniques. And she said, Harold. And I said, well, what does Harold have to say? And she said, well, Harold is like a teenage boy, and he has his arms crossed over him, and he's saying, I'm not talking. So I was able to, through a different kind of backdoor path, finally get her to, to address the issue. And she said, well, it's my father. I said, well, can you think of a specific example regarding your father? No, just everything, And, well, there was this one time. And so she was talking about when she was about 6 or 8, and she had heard neighbors talking about how they didn't have enough money. So she felt sorry for them, and she broke her piggy bank and, put the money on their porch step. And then her parents found out about it, and her father was completely outraged that she had done this because he saw it as an embarrassment to the family. And so he yelled at her and screamed at her, and she got in trouble for it. So that's what she was releasing, and so she was very, 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 very angry. And after the session, I went to the bathroom, and came back, and one of the teacher's assistants was kind of a big man, and she was, pointing her finger at him, rah, 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 so she was still releasing, and I'm sure he hadn't done anything wrong, but she just needed some way to project all that energy towards her father. So anyway, that's the kind of thing that can happen with somato-emotional release. It's usually not that dramatic. Usually in my experience, it's just really, really subtle, and people might tear up for a second, or just, they'll go into a relaxation place, and then they'll kind of jolt awake, and they'll say, oh, I remember what that was. And sometimes you don't remember what it is. But in my experience, it's, other than that one, it's been very, very subtle and very, not dramatic, not traumatizing, just very gentle. So anyway, that's somato-emotional release. And one of the things that Dr. Upledger talks about, specifically in working with autistic kids, but I think it's true really for everybody, but he said in working with autistic kids, he wasn't able to get a full structural release of the membranes until he got the somato-emotional release. So what that looks like with a child is a lot of times they'll cry, and a lot of times, again, it's not real dramatic. It's just kind of, and then they'll release it. There was one videotape that Dr. Silva had done of a Down syndrome little girl that they were working with. And she had had multiple heart surgeries. And when they were doing the Qigong massage over her chest, she started to tear up a little bit. And then she said, I hurt, So maybe I hurt, So it just helps clear all that we don't need to be carrying around, because trauma is a really low vibrational frequency, and the emotions of peace and joy and love are very high vibration emotions. Also, illness is very low vibration. Cancer is probably the lowest. It's a very, very low vibration. So the idea is that when you can increase the vibrational frequency of the body, you increase not only the positive emotions, but you also decrease the tendency of the body to get sick. So if you can release all this trauma, then it helps increase the vibrational frequency. Another principle is that what you resist persists, and it's like the PT I was telling you about that I worked with. She was closed and was not going to go there. She was resisting it, and so it's just going to stay stuck there as long as she resists it. And when you let it go, then it dissipates, it goes away. So it's just very freeing to get rid of the stuck emotion. So there are different types of somato-emotional release. I mentioned craniosacral massage, Qigong massage. Aromatherapy can also help facilitate release of stuck emotions. Does anybody here use aromatherapy? Oh, great. Such a great audience. Everybody. So there are different blends and single oils that facilitate that better than others. Some of the best are Lang Lang, lavender, geranium, sandalwood, blue tansy. There's a Young Living oil that's is called Release. That's a good one too. Touch therapies help release emotions. Has anybody practiced EFT or emotional freedom technique? Okay, good, very good. And so that's similar in a lot of ways to Qigong massage, because you're tapping or patting along the meridian lines or the acupuncture lines. It's a series of pats where you combine it also with dialogue, where you actively release. You choose a topic, and then you pat or tap on these endpoints of the meridians to help release the stuck emotion. Yoga can also help release emotion, and meditation, also talking, counseling, crying, journaling, or a good hug. And I imagine everybody's had this experience where, maybe you've had something really traumatic happen. Maybe, for example, your mother's really sick, And so you go to work and you're holding it together, and it's like, okay, I know Mom's sick, but I got to do my work. I'm holding it together. And then someone comes up and, puts their arm around you and say, oh, I hear that your mom's not doing well. I'm so sorry. And you just burst into tears. So again, it was that kindness and that hug, that touch, that facilitate the release of emotions. So Qigong massage at Kotsanis, as I mentioned, what is suggested to me is that I see a child for 12 sessions. I don't think that's going to be necessary in a lot of cases. I also do an initial and a discharge evaluation. I use the Autism Parenting Stress Index and the Sense and Self-Regulation Checklist. Sessions can include craniosacral therapy, therapeutic touch, and education and nutrition and feeding. And I'll tell you a little bit more about that in a minute. So right now I'm doing private pay. Sessions are $45 for a half hour, $52 for 45 minutes, or $60 for an hour private pay. I'm working towards, or at least I'm playing with the idea of accepting insurance. I'll let you know if that happens, or you can call the office and let them know. I'm exploring that. I haven't decided fully if I'm going to do that, but it would be a copay if I'm able to accept insurance. So the book that you have is by Dr. Luisa Silva, the co-developer of the program. And again, it's Qigong Massage for your child with autism. It's available at Amazon.com, and it's about $22, $25, something like that. Not bad. And the DVD's not long. It just goes through, and Carrie has it there if you want to look. So those are just samples if you want to look through it. I took the DVD out of the back. I didn't take time to find it before I came, but it does come with a DVD. There are two different versions there. The Helping Your Child with Autism is the more current version. So anyway, that's about all I had to say about that, except for the nutrition. I'll mention that real quick. I follow a raw vegan diet, and I teach classes here primarily for cancer patients using this type of diet, and it's a wonderful, wonderful diet. I used to have an autoimmune illness similar to rheumatoid arthritis, and I struggled with that for years. I had a hard time sometimes even turning over in bed. I had a hard time getting out of a chair. I was really, really fatigued. Had a hard time, sometimes I wasn't able to do stairs at all. To get something out of the cabinet, I had to do that because my shoulders were so inflamed. But following this diet, I am now totally off medications. My lab values are normal, and my functional activity is normal, and I'm able to jog. I'm able to pick up my grandkids. I'm totally recovered as long as I stay on the diet. If I start eating more cooked foods, then I start to backslide, so I typically just don't do that. So anyway, I teach classes here. The program that I'm just starting here at the Kotsanis Institute is a research program for cancer patients, teaching them how to do this diet. But it's also a good diet for autistic kids. Some of the considerations, though, is that some autistic kids are sensitive to oxalates or phenols, and you have to take that into consideration because some of the things that I eat are fairly high in those things. But it's totally gluten-free. It's totally grain-free, so no grains, no gluten, no dairy at all, and it's it's organic. There are no pesticides or herbicides. It's a wonderful, wonderful diet and very good for detoxifying. So part of what I can do in your therapy sessions is evaluate your child's diet and give you some suggestions as to how you can improve it, because I know diet is a huge issue for pretty much everybody. So anyway, that's all I had to say, but we have some time for questions. Does anybody have any questions?